Hi, and welcome back to our ongoing discussion of ethics in the field of mental health. So, we've talked a little bit about what ethics are and the different levels of ethics, and a little bit about the different license types that people can be practicing with in the field of mental health. So, regardless of what license type someone is practicing with and the code of conduct that someone is following, there's sort of a overlapping theme for different topics across the board in the field of mental health, meaning that there's different areas and themes within the ethical codes that you'll kind of see throughout different licensing boards. Let me give you a few examples to start with. So, in general, when working in a helping profession, whether it be mental health, medical, physical health, uh, the welfare of clients and or patients is important. I think most would agree that people who are practicing in a helping profession should be avoiding harm and exploitation, should have their clients' welfare in mind, and be working towards practicing in a way that is helpful to their clients, not harmful. I think that's a pretty basic overlapping theme that follows any licensing board in the field of mental health. So, other areas or themes that kind of just flow throughout different ethical codes in the field of mental health, just kind of across the different licensing types, is to avoid discrimination when we're providing services to clients. So, trying to be as fair as we can and seeking out guidance when we run into barriers with that. Practicing within legal and ethical framework, so following the different guidelines and the laws that are associated with the state and the type of license that one is practicing with. Practicing within one's scope of competence. So, an example I like to give with that one is that when I pursued my licensed professional counselor credential, I was very interested in treating trauma. I had noticed a theme with a lot of the clients I had worked with, which was that a lot of them had traumatic experiences in their life, whether it be childhood or multiple experiences throughout childhood, adulthood. I just noticed a lot of trauma and a need for having that specialized skill. So, in order to help people who were impacted by their traumatic history, I couldn't just jump in and start helping. I had to get trained. I had to know how to do that. So, I pursued training in cognitive processing therapy. And later, I also went through the certification process for EMDR. So, depending on the type of treatment that you're trying to learn how to do to help people, you need to get training that is specialized for that. And in some cases, you need to have specialized supervision. In my case, for cognitive processing therapy, I was supervised for quite a while. Every week, and basically had to go through not only the training but also a supervised time period where somebody could be making sure that I was practicing in the way that I was supposed to be. So that kind of is an example of how practicing within one's scope of competence is important, because there are research based types of treatment out there, and they do require training in order to learn how to do them. Understanding and respecting cultural values of clients. So, as we discussed earlier, values and ethics are different, and we all have our own personal values. So, when we work with someone who's from a different cultural background or just a different background in general, they may have different cultural values. And so, we need to be mindful of that and respectful of that when we discover that maybe our values are different, or that we discover that there's a value that a client we're working with has, that we really need to make sure to honor in the therapeutic process. So, again, that might require some training and some supervision when we run into things that perhaps we're not familiar with already. Distinguishing between personal values and professional values. So, in the field of mental health, it's really important that we're not pushing our own personal values towards our clients. So, basically a constant awareness that we must have as individuals who are working in the mental health field, to be aware of our own personal values and also notice if they might be emerging within us when we're talking to clients, so that we can be very mindful that we're not trying to push our own personal values on others. Establishing and maintaining appropriate professional relationships. That's a big one. It has to do with boundaries. So, in certain situations, I like to give the example of working with rural communities. I've had some experiences where I worked in small towns where a lot of people know each other and it's a smaller type of community. So it's really important to be aware of the different types of relationships that you have, and also making sure that you have clear boundaries so that in the therapeutic relationship, there can be that safe space without any dual relationships. And sometimes we have to seek consultation or supervision to figure out situations uh, where maybe we're put in a position where the boundaries become blurred and we need to kind of figure out what to do. So it's really important to maintain those boundaries and also um, continue to be aware of any boundary crossings. Protecting clients' confidentiality and privacy. This one's huge. Just like with any, medical service, with basically with mental health and any helping profession, we really need to be offering a safe, private, confidential environment so that people can feel safe to talk about things that are going on. So confidentiality is very important, and we'll actually have a whole dedicated confidentiality video to kind of review that in more depth and some of the rules and regulations around that. Striving for the highest level of ethical practice, as kind of noted in one of our previous videos, we have aspirational ethics and then mandatory ethics. So if you really want to be practicing in an ethical way, the ideal type of ethics is to be aspirational and be looking for ways to not only do no harm, but also be doing good and maybe even figuring out ways that we can do better as a field. And last but not least, this all ties into self-care as a basic need to be engaging in ethical practice in the field of mental health. Um, if what pops into your mind is why are we talking about self-care, it's because we need to be okay and be working through our own issues and have a solid foundation for ourselves before we can really put ourselves in a position where we can be helping others, and we need to be mindful of that. So self-care is a big component of ethics as well, and we'll delve more into that specifically with a different video. So that's an overview of just some general common themes in terms of ethics that sort of, apply to pretty much any license in the field of mental health. So that's just a basic overview, and we'll kind of go into some of these in a little more depth in other videos. Thank you and have a great day.